All right. Hi, everyone, and welcome. Thank you so much for joining today. We'll get started here in just a moment as others continue to log in. So we'll just give everybody a minute. While you're waiting, feel free to connect with us on social media using our QR codes on the screen. As you can see right there, Kelly's sharing for us. My name is Stacy Padgington. I am the sales director here at Checkpoint EHR, and I'm going to be your host for today's session. So we're excited to have you with us for what I know will be a very informative discussion around CARF accreditation and what it means for behavioral health organizations today. So just some housekeeping items before we jump in. Just a few quick things. Everyone is muted to help us keep the session running smoothly, of course. So we'll save time at the end for dedicated Q&A session. So please feel free to hit the to submit questions throughout the presentation. So at the bottom, you'll notice that little Q&A box that's highlighted in red. You can go ahead and select that and put your questions in throughout the presentation. So today's webinar is also being recorded and a copy will be made available afterwards. So we appreciate everyone taking time out of their busy schedules to join us today. And let's go ahead and I'll introduce the team. Next slide. So I'm joined today by Callie Reinhardt, our Manager of Customer Success here at Checkpoint EHR, who will be helping moderate throughout today's session. And you'll be hearing from our guest presenter, Kathy Griffin, a long-time partner of Checkpoint EHR through Orbit Billing Solutions. And we're excited to have Kathy joining us today and sharing her expertise with our provider community. So before we dive into today's topic, I want to just take a few minutes to share a little bit about Checkpoint EHR. So for more than 20 years, we've partnered with behavioral health organizations to help simplify operations, improve workflows, and support long-term success. And at Checkpoint EHR, we believe an EHR should be far more than a documentation system. It should serve as the mission-critical infrastructure of an organization. So from clinical documentation and billing workflows to operational visibility, reporting, compliance support, and quality management, organizations depend on their EHR every day to keep operations running effectively and efficiently. So as organizations pursue accreditation, prepare for audits, and navigate increasing regulatory expectations, having strong systems, consistent documentation, and accessible operational data becomes increasingly important. So our goal is to help organizations reduce administrative burden, improve visibility across the enterprise, and ultimately support the teams delivering care every day. So how we support you. So at Checkpoint EHR, we focus on helping organizations create consistency across clinical, operational, and financial workflows. So that includes documentation tools, billing automation, reporting, quality oversight, and compliance supporting processes that help organizations stay prepared year-round. One of the themes that you'll hear today is that accreditation success isn't built during the first few weeks before a survey, right? It's built through strong operational habits, measuring outcomes, continuous quality improvement, and a culture of accountability. Those are principles we believe in strongly at Checkpoint EHR and why today's topic is so relevant to the organizations that we serve. So let's shift into today's focus. So CARF National Accreditation Review. So whether you're considering CARF accreditation for the first time, preparing for a survey, or maintaining an existing accreditation, understanding the process, standards, timelines, and strategic value value is critical for organizational success. Today's presentation will cover what CARF accredits, how it compares to other accreditation bodies, what organizations should realistically expect in terms of investment and timelines, the Aspire standards framework, common readiness gaps, and what surveyors are actually looking for during the review process. That's why we're especially fortunate to have Kathy Griffin joining us today. So Kathy is the CEO and co-founder of Orbit Billing Solutions, a trusted partner of Checkpoint EHR for several years, I might add. And together we've supported many behavioral health organizations across North Carolina and beyond. And what makes Kathy uniquely qualified to speak on this topic is that she also served as a CARF administrative surveyor from 2009 through 2019. So she's been on both sides of the accreditation process, helping organizations prepare for surveys while also conducting surveys herself. That combination of operational expertise, compliance knowledge, and firsthand survey experience gives her a perspective that very few professionals in our industry can offer. We're excited to have her share practical insights, lessons learned, and guidance that organizations can apply immediately. So with that, I'll go ahead and turn things over to Kathy.
Thank you, Stacy.
Of course.
Good afternoon, everybody. I'm excited to be here to share some information with you and your agency about CARF. I had experienced a lot of surveys in 2007, 2008. North Carolina was a state that mandated for certain Medicaid services and funding to get this national accreditation. Like you, we sat with many providers and that we were already integrated with from Orbit's billing solutions perspective, and sat with them to talk about the levels of accreditation, what was out there. Certainly many choices to make for accreditation. Mainly CARF was the selection of all the agencies we were working with. You were peers. When you have your surveyors come to meet you, you're going to find that it's a peer that's you're having survey you. So they've been surveyed, and that is takes some pressure off, makes an easy conversation. They run programs much like you do, have the same challenges in federal funding and such. So today I just want to I realize we might have a mixed audience. We might have some who have never done CARF before, some that have done CARF, maybe done really well in 3 years and is getting ready for another survey. These types of organizations, both of them, you got to prepare for, but it's a little bit different to get started. So I'm going to go over some information about CARF, and as we go along, if you have questions, certainly send some over and we'll stop and talk about them as time allows. So let me get started. I'm going to share my screen. Okay. So again, we're going to go over national accreditation, what CARF accredits and why it matters. So CARF is not just a United States-based accreditor. This is across the country. And certain times I was offered to go to different countries to do CARF. The standards are the standards. And it is something that from CARF, the Commission on Accreditation of Rehabilitation Facilities, it's an independent nonprofit accreditor of Health and Human Services, which was founded in 1966. And what I will say is a lot of how CARF lives is through its publications, its standards manuals, and a lot of other outcomes-based materials. And you can see here that over the years, it now holds, it was not the case when we first started with CARF, but it holds the leading share of U.S. mental health treatment facility accreditations. And this goes to the smallest one-person provider to the psychiatric hospitals across the country. That, again, your expectation on an accreditation, you're going to apply, you can get a provisional, a 1-year, or a 3-year accreditation when we arrive to your facility to check things out. Preparation ahead of time with CARF. You definitely, before you apply, want to know what you're applying for and what your preparation needs to be. And we'll go through that a little bit further in the slides. I just wanted to bring up the CARF versus the Joint Commission. For many of us, we have to go to our hospitals to see family members or maybe even go there for ourselves. You'll notice plaques on the wall often that show that you have a Joint Commission accreditation in the hospitals. They are and Joint Commission will accredit your organization. They are more pricey, and they have, here you can see the comparison on the survey style, the cycles that they do, the scope and flexibility. So what I can say is I've been a part of both because I did work for North Carolina in a psychiatric hospital early on in life, and we had to do JCO, the Joint Commission. Much different preparation and interaction with the surveyor, very JCO is very hospitalist and based for that type of information. CARF is serving the community, and that's a lot of what our providers do. And you can see they do peer surveys and things like that, and you feel a much different interaction when CARF arrives with them being peers. So between JCO and CARF, you can certainly go look out on the web more about JCO. It is more costly, but there is a whole level of preparation that goes into it that's a little bit different. CARF is definitely a community-based cycle. Now, we talk about what it actually costs. You have to apply for CARF. When you apply, you have already said in that application that you understand their standards. So really, you should have already bought the standards manual, and you should be going through this information before you apply, so that when you apply and you say you're ready to schedule a survey, it's because you've applied those standards in your organization. JCO does cost more for sure. I can tell you there are a few other organizations that are out there, CQL, COA, they charge differently. I can say that when we did this, like the 2009 cycle I was in to become a surveyor, this was the most affordable for a community program. And the way that the survey day rate goes, I have surveyed with program surveyors. They assign an administrative surveyor and a program surveyor. But if you have a large organization across the state with many locations, they're going to assign more program surveyors. There's always going to be just one administrative surveyor, but that survey day rate does have to encompass how big you are, how many surveys. And when you apply, you'll be assigned a specialist at CARF that will go through a lot of that information with you to make sure they don't underschedule or overschedule too many. And I mean, I've been a part and had to manage travel and all kinds of things for sizes of 12 people being surveyed across the state. It's interesting and very difficult to do, but we got it done. So I think that it is a very economical way to get national accreditation is through CARF. Why I think leadership pursues and renews with CARF when we talk about their integration and what comes from a nationally accredited company. They do prefer, obviously, if you have a peer support program or other programs across the state, which, you know, Checkpoint serves a lot of right now in mental health, there are programs that require accreditation. I know programs that got accreditation just because they wanted to see how they measured up. And the payer does give preference to nationally accredited companies. So the payer access is definitely one that most people enroll for CARF for. The service growth, when we talk about that, of course, they do the analytics on this to say once you become accredited, people expound on the outcomes that they get once they start measuring, and we have leadership involved. You often have growth and great outcomes from following national standards. The outcomes and safety for this, and that's going to be some things I cover in a slide later, but even in the smallest organizations that your home is your business space, has to have safety involved and has to have outcomes that you're looking at. And here they're saying we apply these standards in these organizations, and they can see from those measurements that you have a 20% lower mortality and 15% fewer 30-day readmissions in chronic care populations. So their outcomes, they feel that you apply are succeeding for the person served, which is what it's all about, is your person served. Regulatory leverage is number 4 on here. Like I mentioned, they're going to give preference to you if you're already in a service area and you want to grow or add another program and you're already nationally accredited through CARF. They're going to feel confident that you have a basis that's going to help them and you obviously spring from. The person-centered brand, that is, you'll see in all your CARF manuals that they refer to it as person-centered or person-served, and your organization may call them a client, a patient, a consumer. that we're referencing person-centered plan whenever we're talking about CARF and the person served. That's where all the outcomes are also that they measure and look for, and we can talk further about that. Got some interesting updates for anybody that's in a 3-year accreditation before your next visit to be prepared for. Number 6 is the continuous improvement. So a lot of what we're going to talk about today is going to be how you set the groundwork and you keep it going every year or every quarter. And there's timelines for that. And there's, one of the things I do when we open with leadership and an orientation conferences, we talk about, I tell people, I'm here, it's over 1,000 standards just to sit here today that you have to be compliant with, whether they're written, spoken, or outcome projected. Like, we have a lot of information, but it's always on a continuous improvement basis. All right. Six steps from inquiry to accreditation with CARF. So here's where I was referencing earlier. When you go to apply, the first step before you apply is that you've looked at the self-study information that they provide you. I would also say don't apply without a standards manual already in your hand, because you can't be competent with applying if you don't know the standards. So you should already have a standards manual, and you've done a self-study, which can be as simple as reviewing information, making notes, or actually they have a self-study guide that you can purchase from them that helps go standard by standard. You apply and identify the programs, your leadership, so you'll want an org chart and your locations that gives your CARF appointee for the survey information on how big, how many surveyors we're involving, how far of a location. They won't assign 2 surveyors if you have a program 30 minutes away. So that application, you expect to spend quite a long time going through that with the CARF representative. Preparing, obviously you want, when you apply and spend this money, you want to be ready and get the best out of your money, which everybody wants a 3-year, who doesn't? Although there are times and there's challenges to that before they get there. The Aspire standards, which are the first half of your manual, is got to have a 6-month operational data information to those standards. So you have to prove by the time you apply and they come that you've had that going for 6 months or more. So even if it's in the timelines we'll go through later, even if it says you do this annually, you have had to have done this in those 6 months and said, I'm going to revisit this next year from that standpoint. You'll have on-site survey. Obviously, your peer surveyors are going to come with questions and interview your stakeholders, and I'll go through a little bit more detail or questions on that. Decision and report. So the team gets together with you after your 2 or 3 day survey, sometimes 4 days, depending on how big you are of an organization. And at the end, they talk to you about what they're submitting to CARF as their recommendations. They have a lot of decision tree tools and things they provide with their surveyors that I had operational to me. And some of those decision tree tools, that's one of the things I want to let you guys in on, is if you're out a big standard, you're out all the standards under it. So those things automatically, if you say you're out, it'll deaden the entire tree to say, well, yes, but they do this. It doesn't matter. If you don't do the first branch, you can't get to the second. So that's some things, there's some highly rated standards out there we can talk about, which I'm sure you already have in your organization. And then the 6th step is your QIP and your annual report. So when you are out a standard, let's just say 1, let's say it goes great and you're out 1 standard, you have to write a quality improvement plan and get it back to CARF within 90 days. And then they respond and talk to you about questions, but that's how you're going to conform to the standard, is what you're going to write in your QIP. Every year, if you get a 3-year, shaking your hand, everybody's happy. Don't forget you're a CARF nationally accredited company past that point, and that you have conformance to do to those standards every day. And you check in with CARF once a year regarding that information. And you send in your quality reports. And the person who applies with your survey initially is the person who will reach out to you annually to say your anniversary is coming up. Please send in this information to show you're still conforming to CARF. So they're touching base with you. And certainly you can always touch base with them with questions about standards and things like that after they leave your company, the organization, for a survey. So it is a peer-to-peer relationship after that. The plan for 12 to 18 months from kickoff to survey. So that's what I was saying about before you apply, you're making this choice to have somebody come nationally accredit you on standards. You should be ready for them when you apply. That they're going to ask, have these things been applied already? And you're going to want to know what you're working on. You should have a QIP plan on the standards, very similar to the one that you would send when they leave to say you were out of standard. You're already working on your gap assessment of what the scope and definition and the baseline audits you do. That's step one. And then step two is you've built everything to apply to the standards. You likely have policy and procedures already in place that have a lot of what CARF is looking for. However, you will be tweaking your policy and procedures to match CARF's yearly updates on what they expect from you to be nationally accredited. But in the 4th to 6th month, that's what you're doing, is the tweaks to build the library, your evidence that you have applied these things. And in month 7 to 12, you're implementing those. You have data that shows that these things you have outcomes from that information. In the final 90 days, this is when you put your leadership at the table to be able to put remedies in place. You can do, it's all mock surveys are often used by organizations. They'll ask me to do a mock survey where I come in and be both the program and administrative surveyor to go apply the standards and give your team the opportunity to have the back and forth that occurs during survey so that they understand. It's a lot of nervousness when you have people in front of you asking questions, and there's always good answers to say, let me go get my manual. Let me go get, if you do a readiness survey the readiness survey that you can purchase along with the manual. If you get that, you can also reference that with them, which has, your short answers to what's going on with that standard. So again, this is, you're asking CARF to come in, and I'll speak about North Carolina. I think this is mainly North Carolina providers on today. It could be out from another state, but North Carolina specifically, some of your programs that you build, you have to be accredited day one to do the service. And that's some of your DD services across the state. But then there's other ones that you can build the program, and within the year of the start of the program, you have to have national accreditation. So applying those standards and getting them in can mean different things. For somebody who hasn't even started the service, again, it's the administrative aspire section that you're going to build to show you have ready for use on day one. And I can go through more questions about that a little bit later. If you have any, just send them through and I'll take a look. Aspire to excellence. So this is where it's section 1 of every CARF manual. So you do have different standards manuals, and those standards manuals have to do with the program specific information. Every standards manual, though, has Aspire. And Aspire has to do with the groundwork you set in your agency to prepare for success before your clinical programming. Okay, so you're going to assess your environment, your leadership, and your strategy. S is to set the strategy. So here we're talking about your strategic goals, priorities, your resource alignment, so your stakeholders outside, your referral sources, of course, your person served. So You have to involve them in everything that you do, and in mental health and behavioral health services, we're used to doing that, obviously, but it is something that is very person-centered focused, and you're engaging. A lot of it might be in conversation, but you do have to have some written information on that. You're going to implement what you have set forth in your strategic plan, what you've measured. So your workforce, the rights and accessibility, you're going to make sure everybody has accessibility to your program. And if not, if you have wait lists and things like that, you show that information is being monitored and why. And then in review, that is your performance and outcomes. So here we've said all these things. We said we're going to do these things. Here's the objectives we're going to set. Here's the outcomes that we get. Is in the review, did we get the outcomes we expected? Maybe we didn't. And if that is the case, we want to change those and update our plans and affect the change, which is E, the continuous quality improvement. I have seen many programs set standards and think that they're ready, and when the outcome doesn't project what they want to pick something that does project, but that is not good outcomes. Good outcomes are, you may not make what you thought and how to achieve those. So we'll go more into it. One of the things I wanted to say at the bottom of this slide talks about section 2, and this is across any of the manuals, but in section 2 for clinical care, they have added in 2025 in all the manuals a measured informed care procedure. Measurement informed care, MIC, it's required and is now in all of your 2026 manuals. And now it updated the behavioral health manual to introduce sobering centers under crisis programs. So Aspire contains over 1,000 of the policies, procedures, and standards that are applied to your organization. And that's going to be a big undertaking to get Aspire ready. Now, the different programs, again, the manuals that I was talking about that you can go through on CARF are out there. And here I've outlined them for you. If you're not sure, because some people fit employment and community services and others fit behavioral health, some fit child and youth services. That is what you will use your CARF application program person for. When they go through this, they somewhat have a grid from North Carolina or your state that you're from that maps the program you're talking about, because every state calls it something different, to what they are crediting you for, what's program that applies to. And it can be, and sometimes you need 2 manuals, not just one, for the program you run, depending on how large that program is and what it scales into. Okay. Interestingly enough, I have surveyed every one of these manuals as an administrative surveyor with a program surveyor that worked in one of these programs. So I can tell you they do change. There are differences between behavioral health and employment community specifically. We're used to having to do both in North Carolina. So then I want to do a spotlight, because I know I'm involved with Checkpoint a lot, and some of our customers are with Checkpoint. And the partnership we have, first off, I want to thank them for inviting me today. Should have done that on the very first slide, but want to say they are very supportive of their network, and they are very informative. And here with some of the peer support service providers we have that are in Checkpoint, I thought like a spotlight would be good to talk about that today. You know, peer support people mean they've lived the experience. You're drawing on personal recovery experience to engage members and build trust. And the recovery outcomes, number 2 there, with peer-led services that are linked to higher engagement and reduced hospitalization. Who doesn't want that? Stronger long-term recovery across the SUD mental health populations. In other words, CARF's national standards, your service work, the partnerships that Checkpoint and Orbit build lead to better outcomes for the person served. And we believe that is, I mean, that's our goal. You do have the certification programs. Number 3, the state approved peer support specialist credentials, require your supervised hours, written exams, ethics trainings, and continuous education for them. 4 is Medicaid coverage. Peer support is a reimbursable Medicaid service in 49 states. So, and it is actually called peer support, interestingly enough. Some people call it other things, but this one means it's well known, implemented across the country in the United States. Again, peer support services exist in Australia, exist in Africa. They do accredit this outside of the United States boundaries. And some of these standards you see sometimes and you look at and say, who thought of that? It's somebody in Africa, perhaps. And that's how they do these manuals. So it's an interesting integration when they do that at yearly basis. Then you talk about the roles and settings, number 5. So your peers work across, and by all means, we always stare at each other and go, well, what do you think that falls into? Because it's everything, it feels like sometimes. But you can work across crisis, outpatient, residential services, and the community setting, the recovery community setting, as a part of the multidisciplinary teams. They're an integral part in the trust and the build that the peer, your person served, uses to the foundation to start with. And CARF knows that. So then in the CARF standards on 6 there, the behavioral health manual is where we talk about the peer competencies, supervision, ethics, and integration into care. So this is your behavioral health manual that does your peer support services. Do a time check here. Okay. SAIOP. Okay, that is something that uses, it's a substance abuse across right now in North Carolina. It is called SAIOP, the Intensive Outpatient Program, and it delivers 9 to 19 structured treatment hours per week with substance abuse disorders who do not need residential care. You have ASAM alignment in part 2 there. It talks about how you map to ASAM level 2.1 criteria, reinforcing clinical credibility and supporting the payer. Obviously, they want your ASAM information. The CARF pathway for this is in the Behavioral Health Standards Manual, and it is the outpatient treatment, specifically and noted on the alcohol and other drug addiction. Other drugs/addiction, sorry. State licensure is required for SAIOP. North Carolina, I'm speaking, many states do, and I'm going to assume that it's the majority of the states, but that designation for reimbursement is required. Again, another reason why a layer of national accreditation is a core component to have for serving the population in the Medicaid programs. So you have your core components as number 5, group counseling, individual therapy, family services, MAC coordination, and recovery support. They all fall inside the scope of SAIOP. And you have your readiness signals as 6. Surveyors expect 6 months of operational data and written program description and active outcomes tracking on everyone. Things I would like to share today, I think most important, getting down to the real beef of this meeting, talks about your changes and next steps. If you have already seen CARF and you're confident, you know what it's like, things are coming in, you have to keep up with your manuals yearly. Every year you have updated standards. And right now they have some key 2026 changes they have out there, and you can find it in your manual where it says changes to your 2026 manual. I promise you, as an administrative surveyor, I look for these first when I come in. If you've been accredited for 3 years, I look for the last 3 years of changes in these manuals to say, that's how I know if you're living, breathing CARF in your organization. If it applied to you and you had it in your manual, I should see that you have evidence you've applied it, whether it's a policy, an outcome, so forth. So you have the sobering center standards, new for July 1, 2026. And if you're applying on July 1st, 2026 for national accreditation, you're using your 25 manual. Aspire restructuring. So they used to have an entire section on technology, and what they've done now is they've took that technology function and they've separated it into different areas of Aspire where they feel like it applies more, as electronic medical records, for example. And that might be under their security. So they remove that part altogether. And if you already have it in place, no, don't remove it. It's going to subsequently move through the manual in other places. Now, the measurement informed care, this is the big change for CARF in 25, and you will be expected to show this. If you are a 3-year in this window, you should have already started it, but if today is the first time you're hearing about this, leave this meeting and start it today. So carrying forward from 2025, it's now a baseline procedure. You can go look at things on the National Institute of Health to talk about the measured informed care information, but PHQ-9 for depression is one that's often used as a measured baseline, your questionnaire on depression, and that is a lot of what organizations put in place to meet this standard, was just to start doing the before treatment, mid-treatment, after treatment on the same questionnaire, which that PHQ-9 is what they've been using. You can certainly come up with your own. You can alter and make additional information. It is intended that you are asking your person served before treatment, during treatment, and after treatment, and if there are any changes and success in it, and if not, you show that you're making the changes for them and your program. CCRC, for those retirement communities, they have some care process refinements. We were talking about skin integrity. The dementia aware care, a lot of folks in retirement communities are dementia care residents, and the home and community services that they do from the CCRC. So these things are in your manual. You should find them, read up on them, and put them in place if it applies to you today. The recommended next steps. So we talked about CARF. You're gonna think about applying. Maybe you're ready to apply. Name a project lead, an executive sponsor, someone who's going to take the lead on CARF. You really do need that. You need success in your leadership with applying CARF standards. And if you're a very small program and it's 2 of you, both of you should be involved. It's going to be a lot of work for 2 people. So number 2 there is confirm your program scope and review the 2026 changes summary in your manual. So they often do not drop programs. If you were peer support 3 years ago, you're still peer support today, but sometimes they do branch out and change large programs and branch them into 2, or they'll apply child and youth services in addition to peer support. It's possible. So you look at that and make sure nothing's changed there. Your commission, number 3, commission a gap analysis against Aspire program standards. Like I say, that is the hefty program standards area, over 1,000 of them. And when you look at these changes and what's going on, make sure, go ahead and tell me I didn't do this while I'm there with you as an administrative surveyor. Say, yeah, this one got done late. We're going to do this. We found this. We did a gap analysis, and we have someone appointed to review this now ongoing. Get your stand-up MIC procedure and evidence library ready. Get it ready to get the data analysis. That's today off of this presentation. If you have not done that, please do. It's not going to go well if you haven't. And the 5th part of Mark, survey, remediation, and then submit your survey application. Okay, so we just talked about a lot of things in preparation. You choose CARF, you get that manual, you look at these program standards, you involve your leadership chain, your leadership team, sorry. And you get ready to submit your survey application. And when you do that, you're going to have a lot of information you have to provide them. And 1 through 4 is something that gets you ready because they're going to ask for that. Okay. Okay, so back in 2008, I'm going to tell you guys how I've become a shining star with CARF. It's interesting. there's a lot of standards. Everybody's like, oh my gosh, how are we going to do this? And I found the appendix in these manuals and said, okay, let's start with what we got to have in writing. I mean, there's a lot here, and some things are really just spoken. Yes, we do that, how we do it. Other things have to have written documentation. Okay, so remember me saying there's a decision tree, and if you don't get to you don't get to even rate the rest of the branch if the first step's off. These are the first steps. You got to have these. If you are a nonprofit, you are expected to look at the governance standards and apply them to your organization. And nonprofits will have that discussion with CARF. There's a little bit more of financial, and it's in the Aspire section, so it's in your administrative part, but that's something that you'll go over with CARF. But your code of ethics and conduct, your corporate compliance plan, which is fraud, waste, and abuse, and your legal requirements. So when we talk about legal requirements, adhering to applicable laws, that's more talking about if you have to have a license with North Carolina, for instance, for SAIOP, that your license is still active and running and things like that. That's what that means. Health and safety and rights. Big one. Everybody, I think, is prepared for this. If you know you're starting a program where you're serving the person served, their rights come first. Health, you have to have some health and safety. This one's a big one too, though. Some folks think that they have a couple of fire drills in place and then don't realize that they have not even trained on the drills, and training comes first. Like, you have to train that you have to do the drills. And some of the things that they miss on that stop us from rating the rest of the trees. So you get out, 50 standards because you didn't do the main ones first. And these are the type of things you want to cover with your staff before these things are not just leadership. Everybody involved should know health, safety, and rights. They should know code of ethics and conduct. So you're sharing this with everybody in your organization too, but it has to be in writing. So there in your manual, electronic or published, whichever one you have, you're going to have Appendix A. This is noted in your mock survey information if you were to use their site survey prep guide. And Appendix B. So as we were talking about everything in writing, there are times when you have to review it and update it and keep it valid. And that's operational timelines in your manual. You cross-reference these things. And what this slide does is try to tell you what you're doing on an ongoing basis, whether it's as it occurs, if it's monthly and quarterly, if it's annually, and if it's just a reporting and renewal type service. So critical incidents, and obviously your real-time record documentation for the person served is as it occurs. Grievances is also as it occurs, but you also have time frames within those grievances that you follow up, that leadership gets involved, and all of that revolves into your monthly and quarterly information, your safety drills, your quality record reviews. And it is a sample. You do not have to review every chart. Obviously, it's a sample. Performance data, so your outcome measures, where you're at with that. MIC should be involved with that too, for your performance data. Your annual reviews talk about your strategic, your risk, and accessibility plans. They get refreshed. A lot of providers don't in a 3-year period don't change much in that, but you do have to show you have reviewed it with leadership. And then you update the plan's date, obviously, and say that these are the things we're carrying forward. Emergency procedures, always update those and keep those current. If you put cubicles in your office or things like that you don't think change, but they do. They change the way emergencies happen. You got to make sure that you're pointing to emergency exits that are still there. Things that are easily forgotten once you've set a grid in place and haven't looked at it for a while. Your annual review needs to be on a financial audit and budget. So you have to be fiscally responsible with your program. You should have a budget where you review at least annually, set forth with, you might have payroll, overhead, supplies, things like that. It does not have to be extensive. It just has to show, especially for your smaller providers, that you understand how you're budgeting your money and your program is not susceptible to collapse because you're not looking at what's going in and what's going out to what's coming in. Okay. Reporting and renewal, your conformance to quality. You do that every year with CARF. That's where you say, yes, I got a 3-year. That's great. Here we go. And my year's up, and I'll let you know I'm still applying the standards. We're still checking them, and that check annually, you're checking it and you're checking the changes in your manual annually so that you're immediately implementing them as it goes. And of course, the accreditation term, you can get up to 3 years. That provisional is less than a year. It means that you have more work to do and CARF's going to come back. The best bang for your buck, everybody knows, is that 3-year. It's not easily achieved for the first time. Sometimes it's not easily achieved in someone who's had 3 years, 3 or 4 times in a row and had a lot of leadership changes and didn't understand CARF, and CARF comes in. So hopefully we get set in some 3 years cycles here, and we get some programs in place steps in place that involve you continuously doing improvement and showing CARF standards are being applied annually. One of the hardest things I've seen providers struggle with when we look through CARF is the performance improvement plan. I struggle with it sometimes. I mean, no lie, we sit and talk from across the table at one another about performance improvement, what we're doing and how we're doing it. What I did early on was take a lot of things that were already being done inside an organization and saying you have performance that you're measuring already. You just got to show that you're actually trying to do the improvement part. So you're looking at it and you know that you're measuring it, but what are we trying to do to improve it? Who's going to try to improve it? Who's responsible? Who's analyzing it? And what kind of collection happens on that data? This is just a sample.
Kathy, real quick, I just wanted
Yes.
to jump in and give everybody a time check here. If you
Yes.
have any questions, make sure to pop those into the Q&A section. If you're having any trouble with the Q&A section, feel free to throw them into the chat. We always just remind people, keep HIPAA in mind. You shouldn't be sending any sort of client information in these messages, but just keep that in mind. Hopefully we're not putting any names or anything in there, but yeah, definitely check out the Q&A section and the chat section if you have any questions so we can answer those as we start getting close to time here. Sorry to interrupt you, Kathy. Go for it.
Thank
with
you.
The performance improvement.
I keep peeking at the time of being longer winded than I thought I would be.
You're
trying
okay.
to really give you as much information. It's a big undertaking, and I know everybody has given me their time, so I appreciate it.
Yeah. But yeah, go ahead and keep going
Okay.
with the performance improvement plan right now.
Okay.
I'll keep monitoring for questions.
Okay. All right. So then this is talking about just some samples. What I try to do when I talk to organizations is tell them not to go reinvent a wheel that you already have, North Carolina Medicaid or Medicare, whoever you're serving, already requires you to do some reporting or in the assessment process, collect the data. You already have some things going on that you should just build upon. And here you see where I'm talking about staff training and orientation and things like that go on. It's a part of performance improvement. So just a sample slide to kind of give you an idea. You sit down in your internal agency and look at all the things that you do right now. Do you measure them? Does it apply to performance? All right. Next one is talking about what it feels like after you got through the survey process, after you've turned in your organizational structure and put everybody in place, and now they've given you a date within the next 3 to 6 months for surveyors to come out. As the administrative surveyor, what it looks like is I am coordinating everybody that's coming with me to your organization. I've been assigned a team. I'm going to talk now with who your CARF lead is, which is not always the executive director. It might be the secretary of the executive director, but someone there is a lead for the CARF team and who I'm communicating with. And we could be a group of 6, a group of 2, depending on your agency. If you've never been through it before, it is a very eased back process. If you get a schedule in place, they appreciate that. And this is something they help you build before they get there. So you should be reached out to. Your CARF liaison, whoever you appoint in your agency, should have been contacted by your administrative surveyor 2 weeks before your survey date. You'll be required to send information to that team in addition to information you've sent to CARF. So CARF asks for certain things, then your surveyors who are preparing to come see and learn about you are going to ask you to send them some additional information. They, like I put here, it's talking about performance improvement plans. Interview times with person served, additional survey information they may want to know about, how the length of travel time between two places, things like that. And if you're setting up phone interviews to do remote interviews, how many of those and who it's for. Okay, and the resurvey organizations are reminded that they are to provide proof of conformance for the entire time of the initial accreditation was given. So if you've been given a 3-year award, you should be able to show 3 years of operational timelines, policy review, performance and improvement materials, and etc. They don't ask for all of that up front, but when they get there, if all you've provided them with last year's performance improvement plan, they're going to want to see 3 years worth on site. Okay. So we get through the survey schedule here on the left. It just talks about Monday as an example. And you can see that we're coming in, Kathy and Lori. Kathy's me, Lori's my program as surveyor in this example. I'm coming in to meet and greet your liaison, talk about how we're going to go through the day, travel, things like that. We're going to schedule an orientation, an introduction meeting with your staff and you. I encourage you to include as many people as possible and be open with CARF while they're there. You do not have to stop program services for this, by no means. We've had person serve sit in for this. They've just come in and listened to why we're here. Very supportive. That goes really well when you do that. If you can include person serve, that's great.
I have a couple of questions if you don't mind.
No, I don't mind. And I'm sharing my screen, so I'm glad that you're stopping me because I can't see the questions.
Okay, no, yeah, you're totally fine. That's what I'm here for. So yeah, I have a couple of questions about the manual that have come in. What's the best place to find the CARF manual? Someone was asking, is it available on the website?
Yes, CARF's website. And that's the only place you can get it, actually. You have to order it through them.
Gotcha. And you do have to purchase it.
That is correct.
To get access to it, right?
Yes.
Awesome. Great question there. And then we have another one that's in the same realm of that. So their agency received a 3-year accreditation. Their 3 years will expire next year. Which manual do they need to purchase? Should they purchase a new manual each year or just the manual for the year they're going to get re-accredited? What's kind of the best practice there?
Good question. Best practice is every year you purchase the new CARF standards manual. So you should have a new manual every year.
Gotcha. That's a great thing to keep in mind. I don't know if I would have thought of that initially.
It
makes sense.
I want to build on that answer though. When you go to apply for your survey, the new manuals come out on July 1st. And after July 1st, you are expected to be using the newest manual when your survey team arrives. So if they reference something there, but the conformance is for the 3 years manuals before July 1st, if that makes sense.
Yes, it definitely does. Awesome. Thank you. We did have another question that came in. This one is more of a checkpoint question, so I'll take this one. Someone asked, how will checkpoint support if CARF makes any sort of recommendations related to their survey, things like different documents and templates and things like that in checkpoint. We definitely meet with providers after they do their CARF audit. You can share any sort of feedback that you got from them. We're collecting that pretty regularly, and we apply that, any changes that we could make in checkpoint that would help make that process easier. We have a list of future enhancements that we work on. I know that we're actively working on some changes towards the assessment and treatment plan specifically because of some feedback that we've gotten from some organizations that have gone through CARF audits. But yeah, that's kind of what we do. We'd love to collaborate with you on it. Like I said, we can schedule meetings, or if you just want to send us your list, I know people are busy, that's okay too. And we can add that, to the sort of things that we're working on to try to make that process easier for everybody. Good question though. I'm just checking to see if we've got anything else. I think those are ours right now.
And Kelly, I
let's
will say
Mhm.
on that last question,
Mhm.
Katie and I have been working, she's already drafted some things, and it is about CARF and the assessment process. And I've 20 years of being with EHRs and working at some, baseline products. You're one of the few that integrate these types of things into your program to help providers. It's just so basic set information everywhere else, but she's already working with, like you just said, internally. You have some things getting structured now based on CARF program guidelines.
Right. Yep. I know Katie's reviewed the manuals, and yeah, there's like you mentioned that it's a good idea to get the manual every year. It's because there's a lot of changes every year.
Yep.
So it's not just about it's about the organizations keeping up with them, but letting your EHR know, and we do try to accommodate that as best we can. Someone else asked, does CARF visit all of your locations and facilities? The specific one that asked about it, they said they have 24 across the state of Ohio.
Yes.
Every single one of them.
The surveyor, some of them will remote, they'll do a remote site in. They will want to visit a majority, and they will pick from a sampling on which ones they will visit in person and what other ones you can do remotely.
That's pretty neat.
But if all 24 sites are being nationally accredited, they are involved with the process, yes.
Gotcha. Okay, so someone else followed up with, I think, the manual question. So their CARF is expiring in 2027. So I assume we will need to be compliant with 2027 standards in addition to 2024, 2025, and 2027. That might have been supposed to have been 2026.
Yeah, if you're
So-
expiring in June of 27, you get to use the 26 manual. If you're expiring in
distinction.
August of 27, they have published a July 27 manual. That's when they come out, July 1st of every year. Then that manual is now involved with your survey.
That's a really important distinction to make there, I think.
Yes. Yep.
Yeah, okay. That was the same question there. Thank you guys for these questions. This is awesome. Now we've got several CARF accredited organizations at Checkpoint, and I think a couple of you guys are on here, and then a couple of names that I don't really recognize. So we're excited to have you here and asking questions about your CARF. And well, we have about 2 minutes left. Do you want to go ahead and talk real quick about the 5 common survey failure points?
Yes, I do. So some things, you're going to get surveyed on a lot of standards. And this really is failure points for those 3-year accredited ones, because when you are preparing new, a lot of these things don't show as often as when you've had a 3-year survey. So applaud for the folks that have been on today that have 3-year surveys coming up. You have some things that you have to pay attention to, and that changes in the manual in the front. That's often got to do with policy practice gaps. It's all things that they have put in place that you've missed, but also there might be policies you are providing. And if we ask your staff on that policy and they reflect information that has nothing to do with it, what's in writing, we don't really understand how your policy is applying to your organization. And I often comment to staff, if you are not sure what the policy is, do not try to ramble off to somebody in nervousness. Just say, I know where the policy binder is, and that's how I find the policy. That makes that a lot less challenging on policy practice gaps. Missing signatures and dates, often some things, 3 years, here's my risk management plan. and the risk management plan looks the same every time and nobody signed it or dated it, and it's a 3-year plan, and you got to show that you're reviewing it every 3 years. Or I'm sorry, annually, every year, that there's 3 years of proof there. So make sure you've dated things and show through that operational timeline that they can see that these quarters and dates and months work with what it says. Incomplete staff files, that's a non-negotiable. That's that branch of the tree you do not want to miss on your master tracking. So don't have someone in there that certificates have expired, their CEUs haven't been done. Make sure your staff files are pristine. The inadequate data analysis. This is me talking to you about MIC today. Make sure you get that in place and that you start a data analysis on it. Okay, you may have other things in performance improvement just as important. So don't let me just say that's the only thing. But if you don't have it in your plan today, run to get it in. In the outdated emergency procedures, you added a facility, but you didn't do the emergency mapping for exits or things that you think are common that you may be missing. Do that checklist. Don't overlook it. You know, staff often like to put up the person served posters and stuff, and they'll hang it over emergency information. So be prepared to be able to show compliance on emergency procedures. Thank you, everybody, for your time today. I hope the information I shared with you was helpful. I do have information here if you'd like to reach out to me. Or to Checkpoint. I'm sure they'll get information to me if you have any questions. I'm glad to help. Understand the undertaking you're doing. And if you are confident with your program and present that confidence with the CARF standards, it's going to go really smooth, and you'll have your peers talk. Don't expect 100% conformance. Also, if you're the one who always gets 100 on your paper and that's what's expected, it is a lot of information for that site, that Ohio practice that has 24 sites. That's a lot of staff involvement, a lot of things. And we talk about partial conformance or complete conformance. Sometimes you get partial information. That's kind of behind the scenes talking about how we apply the standards to you. And if we think you're doing the standard great, we can also say you're partially doing it. 2 of your sites really don't even know what we're talking about. And those types of things, they weigh differently on a national survey, and partial conformance is good too.
All right. Thank you all again for joining us today, and a special thank you to Kathy for sharing her expertise and experience with us. Thank you so much, Kathy. We're grateful for the partnership we've built with Orbit Billing Solutions over the years, and for the opportunity to bring educational sessions like this to our provider community. So we hope today's discussion has helped provide greater clarity around the accreditation process and what organizations can do to position themselves for success. So if you have any additional questions after today's webinar, or would like to learn more about Checkpoint EHR, how we can support your organization's operational documentation, reporting, and compliance needs, we'd be happy to continue that conversation. And thank you again for joining us, and we hope you have a wonderful rest of your day.
Thanks, everybody.